Since Thursday's announcement by public health officials, there may be people affected right now. And Pro News 7's Chelsea Goss joins us now with more. Chelsea?
After speaking with Dr. Smulligan, the Public Health Authority, and Public Health Department officials, we here at Pro News 7 found out that there may be more than 37 cases of TB exposure. We were not given that exact number. However, we do know that 37 only represents those of the 250 that were tested within Fannin Middle School. Some parents and family members of students who had prolonged contact with the girl and her direct family members were tested as well, and some of those cases came back positive for TB exposure too. Fannin Middle School students and staff are not the only ones who have been affected by this tuberculosis outbreak. After extensive interviews with the young girl or index case, testing was done for many others outside of the Fannin investigation with whom she had prolonged contact.
There were more than 250 because that was just the school piece, okay? Then there were other people that might have been church contacts or other contacts that we also pursued.
That also means there are more than 37 positive tests for exposure to TB.
We did identify some other people who did have a conversion of their TB skin test in the community, and they have also been offered and encouraged to take the free preventive medicine to prevent them from developing active TB.
The prescribed medication for anyone who did test positive is a daily dose of medication for 9 months. Just
missing one dose here or one dose there during the 9 months is not going to make a major effect. Now, if people are missing a whole month or 2 months or 3 months, then we do worry, was that effective?
In April, 250 students and staff were tested for tuberculosis. 13 of those tests came back positive. However, public health officials did not make a public announcement about those findings.
But we felt like that due to patient confidentiality, that those 13 individuals, we worked with the family.
8 weeks later, a retest was done, protocol for TB testing to allow incubation of the bacteria and more accurate test results. 37 of those tests came back positive, an unexpectedly high number leading the health department to expand the test to all students, faculty, and staff. However, they will not be extending the testing to family members of students or even of infected students.
If the student is simply exposed, they have a positive TB skin test, a healthy chest x-ray, that student is not contagious, and so their family is not at risk.
When Pro News 7 checked in with the Department of Public Health, they still had 7 people who had tested positive on their TB skin exam but needed further examination before knowing if their case was active or latent. Chelsea Goss, Pro News 7.